For people unfamiliar with you, please just tell us your name, a little bit about your background, and really what you've been doing for the last several years.
Okay, well, my name is Brenda Davis. I'm a registered dietitian, and I became a registered dietitian in 1983. So I have been doing this a long time. I became vegetarian, pretty much vegan by 1990. And it was an interesting little journey because I was actually a public health nutritionist in Northern Ontario. I'd met one real live vegetarian in my whole life, and that was it. And I remember making the decision and asking my husband if he would be willing to become vegetarian with me. We had been married about 10 years at that point. Well, 1990. We were married in 78. So anyway, he looked at me and he said, "I thought you'd never ask." Oh, I would love to be a vegetarian. So I count myself very, very fortunate in that regard, because he grew up in Northern Ontario where it's hunting, fishing territory. So anyway, my journey was I became vegetarian, moved out west to the West Coast, and in 92 wrote my first book with my writing colleague Vasanto Molina and Victoria Harrison. And within probably 6 or 8 months, it was a national bestseller. And then my writing partner Vasanto and I continued writing. And so I've done, I would say 10 sort of vegetarian classics, if you will. And I'm working on my 11th, which is a diabetes book. And so have been very actively involved in the plant-based world for about 30 years. And the books Becoming Vegetarian and Becoming Vegan, and now we've got the big Becoming Vegan, and I've done diabetes books and so on. And the other thing that I've done that I think is kind of interesting is in 2006 it was, I was asked to be a part of a research project in the Marshall Islands where they have the highest rates of diabetes on the planet. And so I became involved in that work, and I'm still involved in that work. And it's been quite an experience. So lifestyle medicine has really come into the picture for me. In fact, last year, along with Dr. John Kelly, who was the founding president of the American College of Lifestyle Medicine, we actually did an intervention in Lithuania as a demonstration for the medical school and the government, what you can do in 10 days using a pretty carefully designed plant-based diet. And then we had a press conference afterwards, and so that's a direction that we're moving in, is to, these sort of demonstrations to allow physicians to see how powerful this form of medicine can actually be.
Are you familiar with any of these studies? And if so, can you tell us what they concluded? Number one, the more recent meta-analysis of all the best studies that showed a 31% increase in mortality for people who ate a ketogenic diet. Number two, Gary Frazier's Adventist Health Studies. Number three, Regard Study showing the African American diet is deadly. And number four, Walter Willett Nurses Health Study and the Health Professional Follow-Up Study.
Okay, that's a lot. The first one regarding ketogenic diet, I actually don't believe it was a ketogenic, it was a low carbohydrate diet that they were looking at. We don't actually have really long-term studies of people on ketogenic diets, but definitely we have them on people doing low carbohydrate diets. And consistently, there are no exceptions that I'm aware of in all of the meta-analyses. The 2018 study in particular was quite interesting, but they all show increased mortality of at least 30%, some even higher. We've got some that show increased mortality of 51%. So, but in the lowest carbohydrate eaters. But what you have to understand is there are really 3 places you get macronutrients: carbohydrates, fat, and protein. When you lower carbohydrates, it means you're increasing fat and protein. Where do people who are doing low carb tend to get their fat and protein? often from animal products because animal products are free of carbohydrates, with the exception of dairy products, which contain some lactose, which is a carbohydrate, of course. So a lot of meat, and we know that meat is linked to increased risk of cancer, diabetes, heart disease, and so forth. So it's not any, surprise, in my view, that we're seeing increased death rates in people eating low-carb diets because they're eating a lot of meat. And I think that the other thing for people to realize is that, ketogenic diets in particular do work to accelerate weight loss. People lose weight on these diets. But what we have to understand is that weight loss, you can achieve weight loss doing anything that produces a caloric deficit. In this case, you're not providing enough glucose for the body, so it has to resort to an alternative fuel. You can lose weight smoking cigarettes. You can lose weight going on chemotherapy. Doesn't mean it's a good idea. And I think that's the key. With a ketogenic diet, you're eating mostly fat. You're eating 75 to 80% of calories from fat generally. You're eating about 5% at most carbohydrates. Well, plant foods provide between about 60 and 90% of calories from carbohydrate. Even non-starchy vegetables average about 58%. The only exception is nuts and seeds at about 12%. Well, you're trying to get down to 5%. So what you're reducing is the most protective foods on the planet, plant foods, the foods with the most fiber, phytochemicals, antioxidants, plant sterols and stanols, and all of these protective, the prebiotics that feed healthy gut microbiome. So in time, you're going to pay the price for doing that. We need to maximize protective components, not minimize them. And so that's the whole bit about the low-carb diets. With the Adventist Health Study too, there are actually, I want to bring in a couple of other studies here because there are actually 3 studies that have followed populations who are sort of similar health conscious individuals over a period of time to see who develops what disease. The biggest is the Adventist Health Study 2, with about 96,000 participants, started in 2002 and has been ongoing ever since. And in this particular population, what we see is, so we're comparing meat eaters with semi-vegetarians, with fish eaters, with lacto-ovo-vegetarians, and then vegans. So you've got all of these different groups of people eating different diets, but living similar lifestyles. So they smoke the same amount, they exercise the same amount, they drink the same amount of alcohol. We're controlling for all of these variables. So it's a very fair comparison in the end. So in this case, in the Seventh-day Adventist Health Study, what we see is that the more you remove animal products, the better people seem to do in terms of a variety of endpoints, and so hard endpoints. So we're looking at diabetes rates are about, I believe it's 38% lower for lacto-ovo-vegetarians than the similar health-conscious meat eaters, and about 62% lower for the vegans. And so diabetes, we see lower rates of heart disease, not so much in the women in the Seventh-day Adventist Health Study, but huge differences in the men, with the vegans having by far the lowest rates of heart disease, about 42% lower than the meat eaters. We see lower rates of cancer in the Adventist Health Study too. It was about 16% lower for vegans and about 8% lower for the lacto-ovo-vegetarians. And specific cancers were even more pronounced. Kidney disease was about, I think it was 52% lower in the vegetarians and vegans combined. Now, Epic Oxford, a very similar kind of study following about 65,000 individuals since 1993. They saw a reduced risk of cataracts, 40% less in the vegans, 30% less in lacto-ovo-vegetarians. They saw lower rates of oh shoot, I'm blanking right now, gastrointestinal polyps or these kinds of things. And it was 27% lower in lacto-ovo-vegetarians, 72% lower in the vegans, so a very profound difference. And then in the Taiwanese study, which was over 6,000 people, they've had similar reports. They're comparing the Buddhist vegetarians versus and this is the Tzu Chi group, the Tzu Chi health study. And again, lower rates of diabetes in the vegetarians compared to the similar non-vegetarians, about 51% for the men and about 74 to 75% in the women. And they just had a brand new study, 2018, that just came out showing about a 21% lower rate of non-alcoholic fatty liver disease in the vegetarian. And the vegetarians in that community are almost vegan. There might be a little bit of egg that sneaks in there, a tiny bit of dairy, but very, very minimal. So we've seen, I think these studies are really among the best studies we have long term, looking at the consequences of eating, living relatively healthfully and eating slightly different dietary patterns from, the extreme of the meat eaters to the vegans. And so it's interesting. And the other things that these studies have looked at, particularly the Adventist Health Study and Epic Oxford, is nutritional status of the individuals. And in the Adventist Health Study, the results have been very positive in that regard. Even calcium and B12 they're in good shape. Whereas in Epic Oxford, the calcium and B12, they weren't as in good shape. There are fewer fortified foods, so the non-dairy milks and so on that would provide those nutrients. They're not fortified as much. So we saw more B12 deficiency and more fracture rates, higher fracture rates in the vegans in that study. But with the fracture rates, what was really interesting was that the people that were consuming under 525 milligrams of calcium a day, they had about a 30% increased risk of fractures. But the people who were consuming more than that didn't have any difference in fracture rates compared to the meat eaters. So I think that the lesson in that one was really that we still need to be conscious about including good sources of calcium. And most of our nutrition education for the public teaches you that dairy products are your source of calcium. And so we need to take it upon ourselves to learn about good dietary sources of calcium in the plant-based world. And then the other studies, the third study, what was that one again? Because that one I wasn't as familiar with.
The Regard study?
The Regard study. I'm probably familiar with it, but not familiar with the name.
Regard study showing the African American diet is deadly.
Oh, yeah. I mean, we've got dozens of studies showing the African American diet is deadly. It's very similar to what we call the Western diet, but in some ways it can be even worse because we're looking at often even more sodium and even more fat because there are a lot of deep fried foods and just a lot of fried foods, period. And so it's hugely concerning because it certainly genetically there's an increased risk for higher blood pressure, and that increases your risk for all the cardiovascular diseases and peripheral artery disease and so on and so forth. So it's a huge concern, and I'm heartened to see so many people in the African American community who are really getting on to understanding this and being advocates for a really healthy, whole food, plant-based diet. So I can see changes will come, but it really is a greater challenge there, I think, in some respects. And then the fourth study that you mentioned was?
The Walter Willett Nurses Health Study.
Oh, well, the Nurses Health Study has been a study that, people have been followed. There are two studies there, really. There's the Health Professionals Follow-Up Study and the Nurses Health Study. And these studies have been combined in, meta-analyses and so forth to provide the results of following groups of individuals, nurses and physicians, mostly for about 30 years. In most cases, 27 to 32 years. And looking at, again, the health outcomes. And again, we've got some powerful evidence that meat increases risk of heart disease and diabetes and other diseases. And we've got a lot of evidence for higher fiber, higher fruits and vegetables, reducing risk of disease. Very consistent in these studies, and there are literally dozens of these studies that are out. And one of the things people can always do, if you have an interest in a specific area, is to go to PubMed. All you need to do, it's free. You just type in whatever you're looking for, heart disease, nurses' health study. Just simple words, press the go button, and the studies start popping up. And you can actually read at least the abstracts. The studies aren't always free, but some of them are free. But the abstracts are always free, and you can get an idea of what the findings were. So it can be really, really interesting to do that.